My topic is state-of-the-art surgical management of brain and spine tumors. And let me begin by giving you a very brief description of what tumor is. Okay. Well, a tumor is basically an overgrowth of tissue that can occur in any part of the body. It usually presents as a lump if it's superficially located, that you can palpate it, and it can be classified as benign or malignant, as what Dr. Jimenez mentioned earlier. You describe this as a benign tumor when it's slow growing, and you describe it as malignant either when it is fast growing or when it has a tendency to spread in other parts of the body. Now, brain and spinal cord tumors are also known as CNS or central nervous system tumors because the brain and spinal cord do belong to the central nervous system. And these tumors in general have certain peculiarities. While majority of the CNS tumors in adults are malignant, benign tumors do predominate in children and pediatric population. Now, whether they're benign or malignant, CNS tumors can compress the brain and the spinal cord and produce stroke-like symptoms because of compression. And they can cause headaches, difficulty in speech, and weakness. Now, there are many misconceptions regarding tumors in general. So let me try to discuss and clarify some of these myths. One of the more common questions that I've been asked regarding tumors is it hereditary? Although a small percentage of tumors have genetic predisposition, majority of them, whether benign or malignant, are actually sporadic, meaning to say you don't get them from your parents, and therefore they're non-hereditary. What about stress? It's another very pertinent concern, especially during this time of the pandemic when everyone is really stressed. Does it have something to do with tumor? And the answer is simply no. Stress has nothing to do with tumor development. Now, what about cell phones and other gadgets that emit electromagnetic field? These gadgets also have nothing to do with tumor development. Tumors are basically non-transmissible. They're not infectious unlike your COVID, and fortunately, they're not work-related. Now, again, because of the advent of the pandemic, a lot of people would ask, is this related to vaccine? Well, we know that vaccine, specifically COVID vaccines, have certain side effects, but up to now, science has not proven any correlation to development of tumors. So that's another no. Now, I know this has been discussed earlier, but just let me go through this. I just have one slide regarding signs and symptoms. Well, generally for brain tumors, you can have headaches, vomiting, seizures because of brain irritation, and weakness. For spinal cord tumors, you can also have weakness. Generally, you can have numbness, which will usually coincide with a level of spinal cord involvement. But the most common presentation of spinal cord tumors would be back pain. For the diagnosis, it is the MRI with contrast. It is considered to be the diagnostic imaging of choice for brain and spinal cord tumors. At times, though, your attending may request for other diagnostic imaging such as a CAT scan or a PET CT, or they may even request for blood tests, which may include tumor markers. Now, they can use this screening, or they can use this for monitoring purposes. Now, generally, there are three ways of treating tumors, and they are through surgery, or through radiation, or through chemotherapy. Now, I'll be limiting my talk to surgery, and chemotherapy and radiation will be discussed by the other speakers. So going back, why surgery? Well, surgery has the following roles when it comes to brain and spinal cord tumors. And the first is actually the most important, which is providing histopathologic diagnosis. This is obtained by getting a piece of tumor and having them examined under the microscope. You have to understand that different tumors are treated differently. So it is a must that we have to identify the exact name of the tumor. And that is basically the start of the management or the whole treatment of your patients with tumors, diagnosed with tumors. Second is surgery can palliate symptoms from local tumor effect. If you remember one of the earlier slides that I've shown you, whether benign or malignant, tumors can compress the brain and spinal cord and cause symptoms. So when you do surgery, you take out the mass effect, and therefore it follows that by doing that, you can alleviate the patient of the compression symptoms. Third, obviously, when you take out tumor, you take out tumor cells, and that should provide better tumor control together with the other adjuvant treatments. Adjuvant means, say, whether you need radiation or chemotherapy. Now, this should equate to better or improved survival and a better quality of life for your patient. Now, when we're performing surgery, especially on these delicate organs, and we're dealing with brain and spinal cord, it is imperative, of course, that safety should be our topmost priority. I think that's a given. And fortunately, at Cardinal Santos Medical Center, we have the state-of-the-art equipments that allows us to safely perform advanced surgeries for patients with brain and spinal cord tumors. So in the next few slides, I'll be enumerating the surgeries that we can do and the advancements or state-of-the-art technologies that we have at Cardinal Santos. So let us begin with our operative microscope. Obtained by the hospital in 2019, July of 2019, this operating microscope, it's a Kinevo 900, remains to be the latest and most advanced operating microscope in the country. It has a robotic visualization system that basically delivers a lot more positioning precision. And the microscope features a point lock system which enables a surgeon to observe a larger area inside a smaller cavity. Now, this is particularly helpful when you're doing minimal access surgeries or surgeries with small openings. Now, operating through the oculars of a microscope can be quite uncomfortable for surgeons, especially after 5, 6, 7, or even longer hours. Now, fortunately, high-definition 3D exoscopic surgery is feasible in our operative setup. This allows surgeons to operate while looking at 3D screens instead of the oculars of the microscope. So that is what you see in this picture. That is me and Dr. Jimenez doing exoscopic surgery. You have to wear, I don't know if you noticed, it looks like shades, but it's actually goggles. Those are actually 3D goggles. So that when you look at these 3D screens, you'll have depth perception, and you need that when you're doing surgery. Now, during the start of the pandemic, this exoscopic surgery setup became really very useful. If you look at the left lower part of the screen, again, that's Dr. Jimenez and I doing surgery on a COVID suspect patient with our full PPEs. We obviously cannot use the microscope because of our full face masks, and it prevents us from looking into the oculars or the eyepiece of the microscope. Now, fortunately, with the help of the company that provided us the Kinevo, we were able to mount a 3D film into our face mask and eventually allowed us to perform exoscopic surgeries. And and we were able to not to compromise a patient with this kind of visualization. So we were able to use good visualization despite the pandemic. Now, one of the caveats of using a microscope is that its view is limited to a straight line of sight, missing information behind tissues and corners. Now, the solution is this. It's a Kivo micro inspection tool. It's basically a tool that has a camera at the tip. For those of you who are familiar with an endoscope, this basically acts like one. And with this tool, we can easily inspect crevices and hidden areas for residual tumors. So we can go back. Once we put this in, we see a residual tumor, we can go back and do a better excision of tumors. Now, let me talk about the yellow 560. Certain tumors of the brain and spinal cord may be difficult to distinguish from normal tissue, even under microscopic view. So fortunately, at Cardinal Santos Medical Center, we have the yellow 560 filter. It is a filter attached to the microscope that allows you to view a special dye as it lights up tumor tissue. What you see in this picture is actually a deep-seated tumor under the yellow 560 filter. Now, as I've said, some tumors are just too difficult to distinguish from normal brain tissue. If you look at the picture on the left, there's actually a tumor there surrounded by normal brain. Now, if you're not a neurosurgeon, it will be probably difficult for you to identify it. And let me show you the tumor. So that is your tumor. Now, it takes experience actually to identify these tumors. And some of the examples of these tumors are gliomas. It's a benign tumor. Now, fortunately, with the yellow 560, identification of the tumor is made much easier. Now you look at the picture on the right, if you turn on the yellow 560, the tumor would just light up, and excision will therefore be much made easier. We also have a special filter that we use to assess blood vessels in the brain called the Flow 800. Although its main use is when we're operating on aneurysms and AV malformations and other abnormal vasculature, we sometimes use this to assess patency of the blood vessels that we manipulate when we're operating on tumors. Now we go to another machine, the surgical navigation system. At Cardinal Santos, we use the Stealth Station S8 by Medtronic. It's a computer-based operating room machine that allows surgeons to precisely track instrument positions and project them onto the preoperative imaging data. Simply put, this is the GPS tracking device inside our neurosurgical suite. So that's me using the navigation system. And because this equipment guides surgeons like me to where the exact location of the tumor, we can now be more precise, come up with better planning, and make smaller incisions and do minimally invasive surgeries. It's the same system, or it's the same machine that we use or spine surgeons use when they're removing a spinal cord tumor or doing stabilization surgery, as what you see in this picture. It is most useful when surgeons are inserting pedicle screws or implants in very small bony targets. Now, integrating our navigation system with our microscope even provides more features. If you look at the picture on the left, that's a microscopic view of a tip of the tumor protruding through normal brain tissue, with majority of the tumor still underneath the normal brain. So once the integration setup is activated, the picture on the right is what we see. So I don't know if you see my cursor, but this is now the tumor underneath that brain. Okay, let's go back. So underneath that brain, and we can make our approach a lot easier even without cutting through the brain. We can also put or incorporate the yellow 560 filter and project the contour of the tumor that is hidden under the brain. So different combinations that we can use. Now, identification of important fiber tracts of the brain is one of the more amazing features of our navigation system. The picture shows a low-grade glioma. That's a huge picture on the left, showing a low-grade glioma. That's a kind of benign tumor, and its relationship to some of the fibers responsible for speech. The right lower picture, you see Dr. Ted Visagas doing a pre-operative plan, identifying the critical fibers that we may encounter during our surgical approach. Now, another procedure that we do at Cardinal is a stereotactic biopsy. A stereotactic biopsy is a procedure wherein a neurosurgeon sticks a needle into the brain to obtain tissue diagnosis. At Cardinal Santos Medical Center, we use the Gamma Knife facility for the Lexel frame placement and target planning. So all those computer work are done at the Gamma Knife Center. Now, having done over 300 biopsy procedures, the stereotactic biopsy team at Cardinal Santos Medical Center is the most experienced biopsy team in the country. Nowadays, because we have the navigation system, the biopsy team actually has an option of doing this procedure without the application of a head frame. Another procedure that we do at our center is awake craniotomy. Awake craniotomy is a type of procedure performed on the brain while you are awake and alert. It is usually done in patients with brain tumors that are located in eloquent areas. Surgeons wake up the patients during the procedure to make sure that normal function, such as movement and speech, is not compromised during tumor removal. Awake craniotomy can only be done if an intraoperative neurostimulator is available. And this is what we use at Cardinal, the Nimbus Eye Care. So inside the awake craniotomy, we ask the patient to do certain tasks. For this one, there's a finger tapping, just to make sure that function is preserved. This is the awake craniotomy team consisting of surgeons, several neurosurgeons. You have the neurologist or neuroanesthetists. Now, the same machine also doubles up as an intraoperative neurophysiological monitoring device. That is what we use to monitor cranial nerves, especially the facial nerve, when we excise tumor in the cerebellopontine angle area. It is now known that the use of these intraoperative monitoring device can significantly reduce the incidence of facial nerve paralysis in as much as 50% in these types of surgeries. So this is basically what it sounds like. And once we hear this sound, that sound, once we hear that very loud sound, we know that the facial nerve is very near, and we'll try to shy away from that direction. So now going back, intraoperative spinal monitoring is also available at our center with the help of our neurophysiologists. Not only is it helpful in spine tumor surgeries, but also in other spine procedures such as scoliosis surgery, which is performed by our orthopedic colleagues. And still on spine, minimal access surgeries are usually performed, whether it be because of tumors or other causes such as degenerative diseases. This is made possible again because of the availability of minimal access retractors and surgical equipments designed for small openings. You can't do these types of surgeries when you don't have the proper equipment. Now, this is what our operative suite looks like in a typical spine procedure. The patient lay down using a special spine table at the center with the operative team, the intraoperative monitoring or the IOM, and the neurophysiologists would be on one side. In this case, they're on the left. The navigation system will be on one corner, and the operating room technicians prepare the microscope at the other end of the room. All of these state-of-the-art equipments are available only at the operating suites of Cardinal Santos Medical Center. These technological advancements we combine with the expertise and experience to give our patients the Cardinal Santos care that they truly deserve. Thank you very much.